Okay, hello everyone. Welcome to what's today, February 4th, 2021, the WESTalks presentation. So thanks everyone for coming. The first thing I also wanted to say is that we've hinted at this a couple times, but finally we've announced the West Conference 2021, which is June 9th to 11th. So we've opened the call for abstracts on that. It's a virtual conference, free to join, free to submit abstracts, of course. So there's the link there, but if you just Google West Conference UBC, we've just opened the call for abstracts. So we're happy to, if you want to register or submit an abstract, that would be fantastic. And that is an interdisciplinary conference. So in the past, it's been more focused on engineering, but this year we have students from forestry and earth and ocean sciences and all across campus, everything related to water. So anyone from other side universities is also welcome. So there we go. Okay. So the WESTalks is hosted by IC Impacts and UBC Future Waters. So IC Impacts is a pan-Canadian, Canada-India Research Center of Excellence, which serves as a new model for international collaboration to solve global challenges. And it's been hosted at UBC since 2013. Whereas UBC Future Waters is a new group at UBC, so the UBC Research Excellence Cluster on the future states of water, and it focuses on interdisciplinary research and the intersection of law, policy, and government, and the applied and biophysical sciences. Here's our organizing committee: Abhishek, Layli, Fuhar, myself, Jaskaran, and Furia. And we go. Okay, so yeah, here's the, I'll post this link again for the people that maybe just jumped in, but here's the Padlet. So this is from last week. We had people calling in from all these areas. So I'll post the link again, but it's in the chat. If you can just click on that and then add where you're calling from, and we'll see just how global WESTalks is. All right, so now we get to today's talk. So here's the lineup for winter 2021, and we are at February 4th with Dr. Evan Thomas from University of Colorado at Boulder. Oh yes, and also we have all the previous WESTalks are available online. Last week we had Dr. Mohammed Ataya, and I screenshotted this I think a couple days ago. It was up at 250 views yesterday when I checked. So that's by far our most popular WESTalks online. So, but anyways, all of these are going to be available. So if you miss one, feel free to go back and find them. All right, and with that, we get to today's speaker. So Dr. Evan Thomas, who's the director of the Mortensen Center in Global Engineering and the Global Engineering Residential Academic Program, and holds the Mortensen Endowed Chair in Global Engineering at the University of Colorado at Boulder. He's a tenured associate professor in the Civil, Environmental, and Architectural Engineering and the Aerospace Engineering Sciences. And he's an affiliate faculty with the Environmental and Occupational Health at the Colorado School of Public Health. Dr. Thomas has a PhD in Aerospace Engineering Sciences from the University of Colorado at Boulder and a master's in Public Health from the Oregon Health and Sciences University. Evan's technical background is in water and air testing and treatment, applied from developing communities through all the way to operational spacecraft, which I'm sure is a very exciting field. He founded Sweet Sense Inc., which is supported by USAID and the National Science Foundation to develop satellite monitoring of drinking water services. And daily, the team is monitoring millions of people's water supplies across East Africa. Evan was previously an associate professor at Portland State University and Oregon Health and Science University from 2010 to 2018, the founder of Sweet Lab and the founding director of Global PDX. And with that, I will turn it over to Evan to present. Well, there we go, perfect. And throughout the presentation, if you have any questions, just post them whenever you want in the chat box, and we'll have a good, hopefully 20 minutes or so at the end to address those questions. So just feel free to paste them in the chat box whenever, and we'll get to that. All right, thanks a lot. You're muted.
Right, because we've only been doing this for a year, right? Thanks, everybody. I appreciate the invitation today to visit you. Hopefully we can visit in person again sometime soon. I'm going to share a little bit today about the global context that the Mortensen Center operates in and some of the drivers and challenges that motivate our work. I'm going to share a bit about our particular research, which is focused on using different kinds of feedback mechanisms to try to improve accountability and service delivery in global environmental health. And then I'll also share a few of our example projects over the past few years, some that are a few years old at this point, some that we're working on now. And then at the end, I'm going to share a bit about our particular academic program here at the University of Colorado. So I'll start with this context. This place looks pretty familiar to all of us, of course. What I like about this image, it kind of looks like a graphic, but it's actually a series of stitched pictures of everywhere on Earth on a cloud-free day. So these are real images of the Earth, but this place looks familiar. So let's take another look at the planet. I'm sure most of you have seen this picture before. Of course, as the Earth is seen from space at night and you see visible light, a lot of people's first instinct is that this light shows us where people live, but it really shows us where rich people live. We see Vancouver, we see the United States and Canada, we see Western Europe, we see India and China outlined. But in sub-Saharan Africa, in much of Central and South America and Southeast Asia, we still have over 1 billion people still in 2021 who don't have access to safe drinking water. We have 2 billion people who don't have safe sanitation, and almost half the world's population, over 3 billion people, still use firewood for their daily energy needs. And that's where these people live. This is infrared light as seen from space. Some of these are forest fires, but most of this light is household cooking fires. Household cooking contributes to deforestation and contributes to both indoor and outdoor air pollution, and in turn contributes to the leading cause of illness globally, which is respiratory disease. And the second leading cause of illness globally is diarrhea associated with unsafe water and sanitation. So we still see these critical environmental health and environmental engineering challenges persisting today in 2021. Another quick look at the planet. As global warming is starting to be felt in real terms, the people that are first experiencing the immediate effects of global warming are often those that are in countries that are least equipped or least prepared to mitigate these effects. Along the tropics, we're seeing the most highly variable and variation in rainfall. Wet places are getting wetter, so places that are prone to floods are seeing increasing severity and frequency of floods, and dry places are getting drier. Droughts are becoming more frequent and severe, especially in East Africa, where drought is now effectively an annual occurrence. And we also see other changes associated with a warming planet. Malaria is a parasite that lives in mosquitoes, and malaria has killed more people in human history than any other cause. Nobody else has died of more things than malaria. But the one saving grace of malaria is that it couldn't live above about 5,000 feet because it was too cold. And so population centers like Nairobi, Kenya, or Kigali, Rwanda, grew up because people weren't getting sick from malaria. And just in the past few years, we now see chronic and persistent malaria in Nairobi as the elevation at which malaria can survive increases. So here's who's contributing to global warming and who's benefiting from energy use. It's us. The United States and Canada have the highest per capita use of energy of anywhere in the world, except for maybe a couple of the Middle Eastern states. The United States is the greatest historic emitter of carbon. China, a lot of people know that China is now the leader, but China has a lot of catching up to do. China has 1/3 of the population, or 3 times the population of the United States. And so their per capita energy use is actually considerably less than those of us living in North America. And we've benefited from this energy use. It's driven our economies, it's driven our health, but there's a lot of people who aren't using energy, and those people live here. It's almost the inverse map. I'm gonna go back and forth for a second. So here's who's using energy, and here's the global burden of disease. So these are the folks in the world that suffer the highest disproportionate impact of disease, all causes of disease, but predominantly environmental hazards like sanitation and air quality. So are things getting better, or are things getting worse, or are they getting better in some places and not better in other places? That's one of the questions that we try to examine when positioning our role as global engineers. I'm sure most of you have seen this data before. This tells you a story that things are getting better in the world. In 1990, about 11 million children under the age of 5 died every year from respiratory infections. About 8 million children died every year from diarrhea diseases. And all causes of mortality, especially all top of these 6 top causes, have decreased dramatically over the past 30 years. Now, we still have 4 million children dying of respiratory disease every year, 3 million children dying of diarrhea every year. These are still big numbers, but this progress suggests to many that the policies are working, that the policies of international aid, of trade, of public health are working, and that we have to stay the course. The challenge is that these benefits are not being felt equally around the world. These are the people in the world who have been brought out of poverty over the same time period. In 1990, about 2 billion people were living on less than the equivalent of $1.90 per person per day. These numbers have dramatically decreased to an estimate of about 500 million people today living on less than $1.90. By the way, $1.90 is a crazy small number. If you increase it to about $5.50, half the world's population is below that poverty line. But wherever you put the poverty line, you see that there's been progress in these categories, South Asia and East Asia and the Pacific. What this really means is China and India and the countries around China and India, through national policy, have created a strong middle class and have had the corresponding health benefits and increased energy use. Sub-Saharan Africa, which is home to the vast majority of least developed countries, is actually projected to have an increase in the number of people in poverty over the next 15 years. And Sub-Saharan Africa, for the most part, is a focal point of international aid, of global health, of donor relations and donor investment. And while there is a growing middle class because we see a growing population, the number of people in absolute poverty is actually increasing. So what explains part of this? International development works like this. Money comes in from a donor to do sometimes technical projects, water, sanitation, energy, infrastructure projects that are designed and intended to positively impact health and livelihood. But that impact is often pretty short-lived. About half of water and sanitation programs implemented every year with donor dollars in developing countries are broken within the first 18 months, and most never get repaired. So this business model, and it is a business, it is an industry, is broken. We don't have enough feedback from the impact that we intend into the decision-making and the allocation of funds. Donors want to pay for capital expenses. They hope that countries and communities can pay for ongoing maintenance, but it's not really working. And so we need a different business model and a different lens to think about the most effective and cost-efficient ways of trying to reduce poverty. One model is through feedback. If you have something like a water service or a sanitation service, and you engage in active monitoring of that service, we can create both technical mechanisms, professionalization of services, and contracting mechanisms that can incentivize repairs and operation to try to create a sustainable and cost-effective service delivery model. So this is a very simple diagram, of course. It's how you all have clean water and we have clean water here in Boulder. It's worth remembering that we don't pay the full cost of our water supply. Here in Boulder, Colorado, one of the richest zip codes in the world, not really hugely dense, a lot of natural resources for water, a lot of capital expenses that were made many years ago that we benefit from. When somebody gets their water bill here in Boulder, they're only covering about 60% of the cost of delivering them water. The rest is subsidized through a variety of sources. So we embrace subsidy in the United States and Canada and in Europe for water services. For some reason, the international community has not yet recognized that there needs to be cross-subsidy and wealth transfer to support basic services in the poorest regions of the world. So I'm going to share a few examples of where we've tried to implement improved monitoring and improved contracting to have better sustained services. I'm going to start with the water pump story. So this is a hand pump. Hundreds of millions of people still get their water from these kinds of hand pumps all over the world. This is Rwanda. These hand pumps provide shallow groundwater. Often the water directly out of the pump is contaminated and then often by the time it gets back to the household, the water is contaminated with unsafe levels of fecal contamination. About 75% of households at the point of consumption have unsafe levels of fecal contamination in their drinking water. Also in Rwanda, people cook on open cook stoves with biomass fuels. Rwanda is 80% rural, about 95% deforested, and people still, their only real choice for primary energy use is wood and biomass charcoal. So a number of years ago at this point, we developed a program between 2012 and 2016 trying to intervene with these two health hazards, dirty air and dirty water. One of our interventions was this cook stove, the EcoZoom Dura rocket stove. This cook stove can reduce wood fuel consumption by about 70%. It can reduce emissions by about 70%. Now that's good, but it's not great. The people that study household air pollution and exposure to particulate matter will tell you that on a dose response curve, you effectively have to eliminate indoor air pollution and personal exposure to have a meaningful health benefit. So part of what we do with this kind of intervention is also do extensive behavioral messaging and monitoring to cook outdoors. That's a key behavior change that's necessary to benefit from this kind of stove. And then we also deployed this water filter. This is the LifeStraw Family 2.0, highly effective water filter. It effectively eliminates viruses, bacteria, and protozoa. It has a 5-liter input bucket, 5 liters of storage. We co-designed some improvements to this technology with Vestergaard Fransen for the particular environment in Rwanda. It's an effective water filter, and it's good to have clean water, but you have to use it exclusively, and you have to maintain the water filter. There's quite a bit of behavior change messaging around proper maintenance and cleaning of the filter, as well as exclusive use. And in both cases, both the cook stove and the water filter, if not properly implemented, can negatively impact exposures and disease. If you have a new cook stove and you continue to use your previous cook stove, you can actually increase emissions and exposure. If you have a water filter that delivers microbially safe drinking water, but you only use it intermittently, you can lose some acquired immunity and have a bigger risk of disease. So we have to couple the technologies with extensive support and behavioral messaging. We ran this program in Rwanda. It's still operating today. We reached over 2.5 million people with cook stoves and water filters. We reached everybody in the Western province and the poorest quarter of households with both cook stoves and water filters, about 500,000 people, and everyone in the Eastern province, another 2 million people with the cook stoves. And we ran what's called a randomized controlled trial. The London School of Hygiene and Tropical Medicine and Emory University ran a study over a number of years looking at exposures, so water quality and air quality, as well as behaviors, adoption and use of the stoves and filters, and biomarkers and self-reports for diarrhea and respiratory disease, comparing outcomes among households in the yellow sectors here to households in the blue sectors. This is what the program looked like. We had about 1,000 community health workers working in partnership between our social enterprise, which is called Del Agua, and the Ministry of Health. The program is branded Tebeo Neza, which means to live well, as an official Ministry of Health initiative, but privately financed. We used private financing from Europe because we earn and continue to earn revenue through carbon financing. Carbon credits are associated with reduced use of firewood with both the stoves and filters. And we are able to use that revenue to continue to support the program and sell those carbon credits to buyers, including the World Bank. As an official government initiative, we had a partnership directly with local government officials. So this is a process in which the head of household is signing a contract with the cell secretary, their local government official, agreeing to use these products and not to sell them. It was part of our behavioral messaging strategy and behavioral change theory, is having a little bit of contracting obligation to have households buy in. We also use technology to monitor these interventions. So this was some of our early work with instrumentation. This is a cellular connected, that's a little SIM card, a cellular connected sensor that we installed inside a sample of both the water filters and cook stoves. So we hid them inside the water filters, and we also hid them inside a false bottom of the cook stove. And we ran a number of studies where we compared survey data to data that is collected when people know a sensor is in their water filter or stove. So we have this interaction with communities, compared to a sensor that people don't know is there, that is our best estimation of actual behavior. And out of that RCT, longitudinal study, we saw a pretty significant impact. When people are surveyed, they tell us they use about 1.5 liters of water a day, which is exactly the right answer. When people know a sensor's in their home, it's about 1 liter a day. And when people don't know a sensor's in their home, it's about 0.5 liter a day. So we see several behaviors wrapped up in this simple chart. We see recall bias and courtesy bias. People both know what the right answer is, as well as it's kind of hard to remember how much water you drank yesterday, no matter how you ask those questions. So we see an inflation, which is seen across the board. This has been a big challenge in epidemiological studies. You know, we can prove the water filter cleans up water and we can measure diarrhea, but that messy middle of actual compliance, adherence, and use has been tricky. And then we also see reactivity. When people know a sensor's in their home, they are using almost double the amount of water. I call this the Fitbit for the water filter. So we've been able to build on some of this, both in terms of trying to have more objective monitoring, as well as using instrumentation as a mechanism of behavior change. Whoops. So our RCT results were published in 2019 now, and showed a pretty significant impact. We doubled the number of households with clean water. That's a direct measure of water quality in households. We reduced indoor air pollution among households that cook outdoors by 73%, so also a direct measure of exposure. We reduced diarrhea by 29% and respiratory disease by 25%. These are self-reports, which are often, because surveys are so challenging, are often highly discounted. This figure here is probably our keystone. We took blood samples from children under 5 and flew them back to the CDC in Atlanta throughout the RCT and measured seroconversion, so exposure to cryptosporidium. And we had a 38% reduction of exposure to cryptosporidium, a parasite in water, among children under 5, so highly significant. And then we can project using dose response data and QMRA models that we're able to avert 90 deaths among children under 5 every year and 7,500 disability adjusted life years. So this program was fully deployed in 2016, but is ongoing today. All right, moving on a little bit. So let's go back to that rural water supply issue, where people are actually getting their water from. This is a pretty typical site around the world. For many decades, nonprofits and governments installed hand pumps around the world. And there was a hope that communities could maintain these locally. Unfortunately, that didn't really work for a variety of reasons. So we, along with many others in this sector, have tried to focus on moving the level of intervention from just the technology itself, the water pump, to the entire system behind water service delivery, the social, political, economic system behind basic services. Part of our contribution has been to use that same instrumentation. This is, again, a cellular connected sensor that we've installed now on hundreds of hand pumps in Nigeria, Rwanda, Kenya, and Uganda, a few other places. They're designed to help identify when a pump is in distress. The idea being, if we can identify a pump is broken, we can get out there and rapidly repair that pump and try to have an improvement in water services. We ran a trial in Rwanda a number of years ago now. In the baseline of this trial, a water pump was broken for about 200 days on average. So about half of water pumps were broken at any given time. And when a water pump broke, it didn't get repaired for more than half the year. We compared that model to what's called a circuit rider model, where there were full-time technicians. They were only responsible for about 25 pumps at a time. And they rode around in a circuit on motorcycles to maintain proactively these water pumps. That model got the maintenance interval down to about 60 days and average functionality to 70%. But using our sensor data, by actually saying this pump is broken and going and repairing that pump when our sensor identifies that it's in distress, We got that down to about 20 days and average functionality to about 90%. So we've been building on this work over the past few years at scale in East Africa. This is our Drought Resilience Impact Platform. This is a program we run today where we're currently monitoring using satellite connected sensors about 3 million people's water supplies on a daily basis. One of our star PhD students, Dennis Machara, who's actually in the room today, helps lead this effort. Dennis is a geospatial specialist based in Nairobi, Kenya. He's a full-time geospatial specialist moonlighting as a PhD student with us here at the University of Colorado. And working with Dennis and a number of other stakeholders, we're trying to improve access to water services in Kenya and Ethiopia. This is northern Kenya, where drought is increasingly frequent. It used to be every 10 to 20 years. Now it's almost every year. And when drought hits, people and livestock have to turn to these groundwater aquifers. Now, these aren't hand pumps anymore. These are much bigger electrical groundwater pumps, on average serving water for about 5,000 people at a time. Some are solar powered, some are diesel powered or grid connected, but they often break. About 40% of these water pumps are physically broken. It's not that the aquifers are dry, which is often where you kind of go to quickly with thinking about a broken groundwater system. It's that the infrastructure itself is broken during peak drought. Our effort is try to improve functionality at these key water points. We don't reduce drought, we reduce the emergency associated with drought. This is our theory of change. Through improved water and food security monitoring, so sensors on boreholes, soil moisture sensors, remote sensing data for greenness index, for surface water availability, for rainfall, we can improve drought and groundwater forecasting. One of our partners is the Famine Early Warning System, which is supported by USAID and NASA to provide food security forecasts, and then link that data to contracting mechanisms so that we can incentivize maintenance and repair of critical infrastructure in advance of drought so that people and livestock have access to water during those droughts. This is our current monitoring extent. We're monitoring all of the emergency boreholes in northern Kenya. We're monitoring all of the boreholes nearly in Afar, Ethiopia, and a large number in the northern Somali region of Ethiopia. Combined, this is about 3 million people's water supplies that we monitor on a daily basis. One of our early findings is this inverse relationship between rainwater and groundwater use. So we see up here rainwater as detected by, derived through the CHIRPS remote sensing data set. So we see rainy seasons and we see dry seasons. And then we see the corresponding reaction in terms of runtime at these pumps. So during a time of drought, we see a big increase in use of groundwater. This is a human response. This isn't recharge of the aquifers. In northern Kenya, at least, these are ancient fossil aquifers. This is a behavior that we observe. And we're doing this work in the United States as well. This is the Ute Mountain Ute, tribal lands in southwest Colorado. We're working with the Ute as well as the Navajo to install this same technology on their livestock wells to improve management and drought climate resilience among tribal communities in the United States. Okay, I'm going to share just a couple other quick projects before we get into a bit about what our academic program focuses on. Building on our cookstove work and our behavioral reactivity work, we've also been a part of a very large National Institutes of Health trial called HAPPN, the Household Air Pollution Intervention Network, which is running in 4 countries, including Rwanda, trying to establish the maximum possible health benefits associated with clean cooking. And our role was to apply instrumentation. This is a particulate matter sensor that shows you the particulate matter visually to you in that household. And one of our PhD students, Chantal Irabagiza, developed this technology and deployed it in Rwanda to help encourage households to respond to their indoor air quality. Another project, actually also in Rwanda, we have a lot of work in Rwanda. We've been working there for about 18 years. This is a pedestrian footbridge installed by an organization called Bridges to Prosperity. Rwanda is very mountainous and rainy, and flooding can isolate communities. It's dangerous, of course, to try to cross a river during a flood, but it also isolates communities from markets, both agricultural markets as well as labor markets, from schools, from hospitals. And floods are increasing in severity and frequency in Rwanda, evidently because of climate change. So we see these water-related natural disasters and extremes, both as drought and then just a few, 100 miles south as floods. Bridges Prosperity is installing hundreds of these footbridges in Rwanda, and our team at the University of Colorado was contracted by USAID to do a health, economic, and educational impact evaluation of these bridges. So we're running a 5-year trial as a randomized control trial to directly evaluate the impacts of these bridges. We just finished a pilot study where we saw a 25% increase in labor market earnings attributable to the footbridges. And this study is led by our managing director, Dr. Laura McDonald, here in our center. We have a lot of different measurement techniques we use. We take direct measures of nutritional status. This is a little tape measure so that you can measure the health and nutritional status on a growth curve of children. We have cameras, motion activated cameras installed at the footbridge sites where we monitor use, and we can look at when people are using the bridges, how that correlates to climate variability. This is part of Dennis's research as well, is looking at the determinants of bridge use, especially from a climate lens. And so this is another big area of research for us. Okay, I'm going to zoom back out now for a second and talk about how we view the role of engineers working in this space. So what is global engineering? We think global engineering is a complementary field to global health and development economics, but also we seek to look backwards a little bit more than we normally do with technical projects. We are concerned with the historical and political dimensions of perpetuated poverty. As engineers, we look at things like standards development, system science, experimental impact evaluation, data, contracting, as I mentioned today, structures and settlements, of course, the core environmental health that's been an area of research for a long time for engineers in this field, and education, both at the undergraduate level, at the graduate and PhD level, and for working professionals. The Mortensen Center in Global Engineering is both a research center and an academic program here in our College of Engineering. We have about 200 undergraduates in our program taking our classes, working with the student clubs, including Engineers in Action and Engineers Without Borders, and earning our Global Engineering minor. We have about 70 graduate students either earning a graduate certificate in global engineering or a professional master's in global engineering. And we work in about 20 countries around the world, both through our practicum program, where students are directly matched with often NGOs working in lower or middle income countries. And we do about $5 million a year in research expenditures, which is mid-sized for a center like ours here at CU. These are our pathways of our education program. Our undergraduates take Introduction to Global Engineering and then a number of electives in foreign language, and then also have a global experience, either through a student club like Engineers Without Borders or Engineers in Action, or through a project with our center. We have an opportunity to earn joint bachelor's and master's degrees, which can also flow into our graduate pathway, which also includes a core class in global development for engineers taught by a retired World Bank economist, and then a selection of 6 1-credit 5-week modules. So we actually broke up this semester-long 3-credit model into 5-week modules. In fact, my entire class, Intro to Global Health, is in our seminar today because this is the same as our class time. So we have Intro to Global Health for engineers. We have Intro to Development Economics for engineers. That offer a little bit of breadth for our students. And then we have depth as well, impact evaluation or data analysis or water and sanitation or household